Hello everyone again, so we're going to look at fluid and electrolytes today. Electrolytes are elements or minerals found in bodily fluids that become electrically charged particles, cations or anions. They're responsible for many activities of the body, including automaticity, nerve impulses, movement of water and fluids, and chemical reactions. They allow the cells to generate energy and maintain cell wall stability. Hormones produced by the kidneys and adrenal glands control most electrolyte levels. Reasons for electrolyte imbalances are abnormalities occur when electrolyte concentrations are imbalanced between intercellular and extracellular fluids, kidney dysfunction, lack of water as of dehydration or diarrhea, medication side effects. So let's have a look at sodium. Sodium is an electrolyte and a mineral. It's most often found in the plasma outside the cell. Transmit electrical impulses in the heart and the nervous system. It regulates water distribution and fluid balance throughout the entire body. It helps regulate acid-base balance. Normal levels are 135 to 145 milliequivalents per liter. Intracellular level is 10 to 12 milliequivalents per liter. Sodium imbalances normally related to changes in the total body water and not changes in sodium. Sodium imbalances can lead to hypovolemia or hypervolemia. Foods high in sodium include cheese, celery, dried fruits, ketchup, mustard, olives, pickles, preserved meats, sauerkraut, soy sauce. All prepared foods, canned and packaged, and fast foods are very high in sodium. So let's have a look at hyponatremia, which is a low sodium. Signs and symptoms include headache, lethargy, and confusion, mild anorexia, nausea, and abdominal discomfort, muscle cramps and weakness, mental status changes, and decreased level of consciousness, seizures and tremors, orthostatic vital signs. Causes of hyponatremia: most common electrolyte disorder. It's more common in very young or very old. Many causes, sometimes caused by water intoxications. Too much water intake causes sodium dilution in the blood and still overwhelm the kidney's compensation mechanism. Can be caused by a syndrome of inappropriate ADH or antidiuretic hormone secretion. It's often caused by increases in antidiuretic hormone. Other causes include profuse diaphoresis, vomiting, diarrhea, draining wounds, excessive blood loss, some medication side effects, and renal disease. Okay, ADH. So what is ADH? Antidiuretic hormone. Sodium levels are affected by ADH. It affects the water absorption in kidneys. Increased ADH causes kidneys to reabsorb more water and can lead to hypervolemia. Decreased ADH leads to less water reabsorption, which leads to more excretion and can lead to hypovolemia. Okay, what is aldosterone? Sodium levels affected by aldosterone as well. It's a mineral or a corticoid produced in adrenal cortex. It affects water absorption in kidneys. High aldosterone causes the kidneys to reabsorb more water and can lead to hypervolemia. Low aldosterone causes less water absorption, which leads to more excretion and can lead to hypovolemia. Now, there are three main types of hyponatremia: hypovolemic, euvolemic, or hypervolemic. Hypo, when the total body water is decreased; euvolemic, when the total body water is kind of the same but slightly increased; hypervolemic, and the total body sodium increases. Total body sodium decreases in hypovolemic, so remains normal in euvolemic and increases in hypervolemic. Extracellular fluid volume decreases in hypovolemic, increases in euvolemic, and increases with edema in hypervolemic. Signs and symptoms of hypovolemic hyponatremia: low volume and low sodium. It's the most common type. Dry mucous membranes, tachycardia, decreased skin turgor, orthostatic vital signs. Signs and symptoms of hypervolemic hyponatremia: high volume and low sodium, is Rayleigh S3 gallop in the heart, jugular venous distension, peripheral edema, ascites. Interventions and treatments is basically we need to first determine and treat the underlying cause. Get good IV access. Send blood works to the lab. Start IV fluids or lactate ringers. Check capillary blood glucose. Hyperglycemia can cause false hyponatremia lab results. Pad side rails if seizure activity is present. If levels are below 120, patient may need to be prepared for intubation. So what's the IV fluid correction for hyponatremia? Correction should be at the rate of 0.5 milliequivalents per liter if no symptoms. If symptoms, then increase the sodium by 4 to 6 milliequivalents per liter in the first 2 hours. No more than 10 to 12 milliequivalents per liter in the first 24 hours and no more than 18 milliequivalents per liter in the first 48 hours. Alright, so now we come to hypernatremia or high sodium. High sodium is very rare to see sodium over 145 milliequivalents per liter, as 50% of cases are fatal at that level. It leads to intercellular dehydration because water follows sodium into extracellular spaces. More common in very young. Women who have poor nutrition have poor milk production for their newborns. Signs and symptoms include restlessness, change in mental status, irritability, and seizure activity, nausea, vomiting, and increased thirst, ataxia, tremors, hyperreflexia, flushed skin, increased capillary refill time, decreased cardiac output related to decreased myocardial contractility. Causes usually associated with dehydration, there is too little water. Water loss can occur from vomiting, diarrhea, or excessive sweating, or from drinking fluid with high salt concentrations. Decreased thirst drive, elderly, dementia patients, and newborns can result in hypernatremia. Decreased water intake leads to free water deficit and leads to high sodium. Diabetes insipidus. Diabetes insipidus is an uncommon condition when the kidneys are unable to concentrate urine or conserve water. The amount of water conserved is controlled by antidiuretic hormone and is also called vasopressin. Symptoms include polyuria, excessive thirst, inappropriately dilute urine. Lab tests include urine analysis and strict input and output measurement. Treatment: the cause of the underlying condition should be treated whenever possible. It may be controlled with vasopressin pills or nasal spray. Treatment includes we first need to determine and treat the underlying cause, get good IV access, send the blood work to the lab, increase sodium intake orally or correct with hypotonic sodium IV fluids. 0.45% so normal saline allows slow reduction of sodium levels than 5% dextrose. Now we look at potassium. Potassium is most concentrated inside the cells. It regulates muscle tissue contractility, including heart muscle. It helps control cellular metabolism, converts glucose to glucagon for muscle fuel. It's regulated by kidneys and excess levels are removed by feces and sweat. Serum potassium levels are controlled by sodium potassium pump, pumps sodium out of the cells and allows potassium back into the cells. Normal levels are 3.5 to 5 milliequivalents per liter. Foods rich in potassium include artichokes, apricots, avocado, banana, beans, chocolate, carrots, cantaloupe, green leafy veggies, mushrooms, melons, nuts, oranges, prunes, potatoes, pumpkins, spinach, and tomatoes. Alright, so hypokalemia, that's a low potassium. Signs and symptoms include muscle weakness, aches, cramping, paresthesias, confusion, fatigue, syncope, hallucinations, low blood pressure, palpitations. Polyuria and uric with low specific gravity. ECG shows U waves or increased QT interval, flat T waves in depressed ST segment. ECG chart is needed in these patients. Causes of hypokalemia include nausea, vomiting, and diarrhea, diabetic ketoacidosis, laxative abuse, diuretic medications, high corticosteroid levels, insulin. It can cause shift of potassium out of the blood and into the cells, so hypokalemia, magnesium deficiency, medicines used for asthma or COPD, acute renal failure, high aldosterone levels. Okay, so what is a Cushing's disease or Cushing's disease? Now, it's a condition where the pituitary gland releases too much adrenocorticotropic hormone or ACTH. It's usually due to a tumor. ACTH stimulates the production and release of cortisol, a stress hormone. Too much ACTH is too much cortisol. So what are the symptoms? Upper body obesity or within thin arms and legs, round is full face, moon face, collection of fat between the shoulders, buffalo hump, excess hair growth on the face or the neck or chest, irregular menstrual cycles, decreased sexual desire, depression, anxiety, fatigue, frequent headaches, and hypertension. Lab test to confirm elevated cortisol levels. Testing is then done to determine the cause. Radiation treatment or surgery to remove the pituitary gland tumor. If the tumor doesn't respond to surgery or radiation, medication can be used to slow cortisol production but will need to be taken for life. Intervention and treatment for low potassium include milder potassium, low potassium, or severely low potassium, and we need to determine what's underlying cause. Get good IV access, send the blood work and urine analysis to the lab. Increase potassium intake orally or correct with IV fluids. Never give potassium by IV push. IV treatment of low potassium depends upon the serum potassium concentration. Then IV potassium dose is determined as based on the serum potassium concentration. Important is to recheck serum potassium concentration. Rate of IV potassium infusions is 10 milliequivalents potassium per hour, but can be increased to 20 milliequivalents per hour. Continuous cardiac monitoring and infusion via central venous catheter are recommended by infusion rates more than 10 milliequivalents potassium per hour. Maximum concentration is 80 milliequivalents per liter via peripheral vein, up to 120 milliequivalents per liter via central vein. Alright, after hypokalemia, we have hyperkalemia or high potassium. Signs and symptoms can be life-threatening if potassium causes a potential life-threatening heart rhythm. ECG changes include peaked T wave, prolonged PR interval, wide QRS complexes. Nausea, fatigue, muscle weakness and tingling sensation, bradycardia, weak pulses. Need an ECG chart. Causes are often related to renal issues, acute failure, stones, inflammation, transplant rejection. Potassium builds up because it can't be excreted in the urine. People who are using potassium supplements. Steroid use, NSAID use, some diuretic use, ACE inhibitors. Severe burns or trauma injuries. Overuse of salt substitutes. Rhabdomyolysis. Metabolic acidosis or ketoacidosis, the acidosis and high glucose levels work together to cause fluid and potassium to move out of the cells into blood circulation. Alright, so what is Addison's disease? Okay, now it's a disorder that occurs when the adrenal glands do not produce enough hormones. Hormones such as aldosterone regulate sodium and potassium balance. So symptoms include change in blood pressure, heart rate, fatigue and weakness, nausea and vomiting, and diarrhea, skin changes, darkening or paleness, loss of appetite, salt craving, unintentional weight loss. Lab tests show increased potassium, low serum sodium, hypotension, low cortisol. Treatment is replacement of corticosteroids, which will control the symptoms. Patients often require a combination of glucocorticoids and mineralocorticoids. Treatment for high potassium is restriction of medication use, IV diuretics such as Lasix, to decrease the total potassium stores by increasing potassium excretion in the urine. Caxylate. It binds the potassium and leads to its secretion from the GI tract. With high levels, a special IV cocktail is often used, calcium gluconate to protect the heart, sodium bicarbonate to alkalinize the plasma, IV dextrose to attract the potassium, IV insulin. Okay, so cocktail, calcium gluconate, sodium bicarbonate, IV dextrose, and IV insulin. Continuous cardiac monitoring and frequent vital signs is very important. The next electrolyte is calcium. Calcium, about 90% of the body's calcium is stored in the bones, but cells, especially muscle cells and blood, also contain calcium. It's essential for formation of bone and teeth, muscle contraction, nerve signaling, blood clotting, normal heart rhythm. Calcium levels are regulated primarily by two hormones, parathyroid and calcitonin. Normal levels are 8.6 to 10.4 milligrams per deciliter. So what are the foods high in calcium? Cheese, milk, broccoli, yogurt, sardines, mustard, dark greens like spinach, kale, collards, soybeans, okra, rhubarb, calcium fortified foods such as some orange juice, oatmeal and breakfast cereals, white beans, almonds, sesame seeds. Okay, let's have a look at hypocalcemia or low calcium first. Signs and symptoms of low calcium increased neuromuscular irritation. Schwastek sign is a tapping on the facial nerve causes a twitching of the facial muscles. Trocheus sign, inflating the BP cuff for several minutes causes muscle contractions including flexion of the wrist and metacarpophalangeal joints. ECG changes in prolonged QT interval, heart block and ventricular tachycardia. Depression, dementia, anxiety, mental status changes. Hypotension, diaphoresis, bronchospasm and stridor. Bone pain, fractures, osteomalacia and rickets. ECG chart is again needed in hypocalcemia. Causes: hypoparathyroidism, hyperphosphatemia, chronic renal failure, pancreatitis, sepsis, liver disease, decrease albumin production, osteomalacia, malabsorption, inadequate absorption of nutrients from the intestinal tract, vitamin D deficiency or magnesium deficiency. Hypoparathyroidism is an endocrine disorder where the parathyroid glands do not produce enough parathyroid hormone. Parathormone helps control calcium, phosphorus, magnesium, and vitamin D levels within the blood and the bone. Blood calcium levels fall and the phosphorus levels rise. The most common cause is injury to the gland. Sometimes can be caused as a side effect of radioactive iodine treatment for hyperthyroidism. It may lead to stunted growth, malformed teeth, and slow mental development in children. Okay, hyperphosphatemia. Phosphorus is critical for bone mineralization, cellular structure, and energy metabolism. Causes hypocalcemia by precipitating calcium, decreasing vitamin D production, and interfering with parathyroid hormone. Considered significant when levels are greater than 5 in adults or 7 in children. Patients commonly complain of muscle cramping that may lead to tetany, delirium, and seizures. Interventional treatment includes seizure precautions, IV calcium gluconate 1 to 2 grams over 20 minutes with vitamin D. Precautions are taken to prevent seizures or laryngospasms. The heart is monitored for abnormal rhythms until the patient is stable. 1 gram calcium gluconate is equivalent to 90 milligram elemental calcium. Oral calcium 1 to 3 grams per day with oral vitamin D. Sunlight therapy. Okay, IV treatment is dependent on the serum calcium concentration. Preferred calcium salt is gluconate. The dose varies according to the serum calcium concentration, and it's important to recheck serum calcium concentration. Okay, hypercalcemia or high calcium. Signs and symptoms include fatigue, lethargy. ECG changes include increased PR interval, short QT interval, depression, paranoia, hallucinations, and coma, polyuria, flank pain, kidney stone formation, decreased neuromuscular excitability, so hyporeflexia, weakness and poor coordination, decreased GI motility, nausea, vomiting, constipation, hyperactive bowel sounds. Causes 90% are by hyperparathyroidism or malignancy. Addison's disease, Paget's disease, vitamin D intoxication, excessive calcium intake is like in milk alkali syndrome, hypothyroidism or too much thyroid hormone replacement, prolonged immobilization, sarcoidosis, use of certain medications such as lithium, tamoxifen and thiazide diuretics. Hyperparathyroidism is the most common cause of high calcium. Due to excess parathormone released by the parathyroid, parathormone raises serum calcium levels while lowering the serum phosphorus concentration. Serum calcium is elevated and bones lose calcium. Surgical removal of the affected glands is the most common cure. Addison's disease is a disorder that occurs when the adrenal glands do not produce enough hormones. Hormones such as aldosterone regulate sodium and potassium balance. Symptoms include changes in blood pressure or heart rate, fatigue and weakness, nausea and vomiting and diarrhea, skin changes, darkening or paleness, loss of appetite, salt craving, unintentional weight loss. Lab tests show increased potassium, low serum sodium, hypotension and low cortisol. Treatment is by replacement of corticosteroids which control the symptoms. Patients often receive a combination of glucocorticoids, cortisone or hydrocortisone, and mineralocorticoids. Paget's disease is a chronic skeletal disorder which may result in enlarged or deformed bones in one or more regions of the skeleton. It involves abnormal bone destruction followed by irregular bone regrowth and results in deformities and weakness. The new bone is bigger, but it's weak and filled with blood vessels. Intervention treatment for high calcium. Bisphosphonates is a first-line treatment. It prevents the bone breakdown and increases the bone density. It takes 3 months or longer before bone density begins to increase. 0.9 normal saline IV leads to natriuresis, which leads to increased calcium excretion. Calcitonin, when taken by shot or nasal spray, will slow the rate of bone thinning. Lasix promotes fluid and calcium excretion. The next electrolyte is magnesium. Magnesium is the fourth most abundant mineral in the body. 50% of the total body magnesium is found in bone. 50% is found inside cells of body tissues and organs. Only 1% of magnesium is found in blood. Magnesium helps maintain normal muscle and nerve function, supports healthy immune system, promotes normal blood pressure, is involved in energy metabolism and is needed to move other electrolytes in and out of the cells. It stimulates the parathyroid glands to secrete parathyroid hormone. If these glands do not produce sufficient hormones, the level of calcium in the blood will fall. Normal levels are 1.7 to 2.6 milliequivalents per liter. Foods high in magnesium are wheat bran, almonds, spinach, oatmeal, peanuts, coconuts, grapefruit, chocolate, molasses, oranges, seafood, soy milk, raisins, lentils. Hypomagnesemia or low magnesium. Signs and symptoms cause neuromuscular irritability and irregular heartbeats, laryngospasm and hypoventilation, apathy, mood changes, agitation and confusion, insomnia and anxiety, anorexia, nausea and vomiting, tremors, hyperreflexia, leg cramps and muscle weakness, seizures. Magnesium deficiency has been associated with hypokalemia, hypocalcemia and cardiac arrhythmias. Causes: magnesium deficiency is often associated with low blood calcium or low potassium. Examples: irritable bowel syndrome, ulcerative colitis, because magnesium is absorbed in the intestines and then transported through the blood to the cells and tissues. Alcohol and withdrawal from alcohol, hypoparathyroidism, malnutrition, kidney disease, pancreatitis, medications like diuretics. Large amounts of magnesium can be lost by prolonged exercise, excessive sweating, or chronic diarrhea. Hyperparathyroidism is an endocrine disorder where the parathyroid glands do not produce enough parathyroid hormone. It helps control calcium, phosphorus, magnesium, and vitamin D levels within the blood and the bone. Blood calcium levels fall and the phosphorus levels rise. The most common cause is injury to the glands. Sometimes can be caused as a side effect of radioactive iodine treatment for hyperthyroidism. It may lead to stunted growth, malformed teeth, and slow mental development in children. Interventions include seizure precautions, magnesium sulfate, 25 to 50 mg per kilogram per dose, 30 to 60 mg per kilogram per day for maintenance. IV dose exceeding 2 grams must be given over 120 minutes via pump. 500 mg magnesium sulfate is equivalent to 49.3 mg elemental. Doses exceeding 2 grams must be infused over 60 to 120 minutes. IV treatment again is dependent on the serum concentration. Magnesium sulfate is the modality of choice, and we have to recheck magnesium. Okay, so hypermagnesemia or increased magnesium. Signs and symptoms: too much magnesium depresses the nervous system and breathing and produces neuromuscular and heart effects. Hypotension and bradycardia. Diaphoresis and flushing. Drowsiness or decreased mental status. Decreased heart rate, tall T waves, and ventricular dysarrhythmias. Hyporeflexia, weakness, and paralysis. Causes: dehydration, Addison's disease or other adrenal gland disease, hyperparathyroidism, hypothyroidism, kidney failure, acute acidosis. Intervention and treatment for high magnesemia. Circulatory and respiratory support: 1 gram calcium gluconate to reverse signs and symptoms including respiratory depression. Administration of IV Lasix to increase magnesium excretion, only when the renal function is adequate. Hemodialysis may be used in severe hypermagnesemia because about 70% of serum magnesium is not protein bound and can be removed through dialysis. I hope you liked our video. Keep coming back for more. Don't forget